from food abuse issues to substance abuse. Substance abuse and substance dependence are related to the use of alcohol, CNS depressants, CNS stimulants, opioids, hallucinogens, and cannabis. A substance abuse disorder results in an inability to fulfill usual responsibilities, financial and/or legal problems, interpersonal relationship problems, and substance use in situations that are physically dangerous. Both dependency and tolerance can develop with substance abuse. So what's the difference between substance abuse and dependency or tolerance? With substance abuse, there's an inability to fulfill responsibilities, financial or legal problems, interpersonal relationship problems, use in dangerous situations. With substance dependency or tolerance, it takes increased amounts of substance to produce same effects. Withdrawal occurs when substance use ceases. Psychological dependence with the need to maintain a state of well-being or performance, and causes distress in important areas of functioning. Assessment of a substance abuse disorder must include a history and physical, family history of addiction and mental illness, blood alcohol level, blood or urine level for presence of illicit substances, legal history, and social assessment. Let's start with central nervous system depressants. Central nervous system depressants can lead to substance abuse and dependence. This includes alcohol, sedative hypnotics, and anti-anxiety medications. Abuse of CNS depressants such as alcohol can lead to physical, psychological, and socioeconomic problems. Do you remember the symptoms of withdrawal from alcohol use? Elevated vital signs, anxiety, tremors, increased psychomotor hyperactivity, insomnia, nausea, vomiting, abdominal cramping, seizures, and hallucinations. Symptoms of withdrawal from CNS depressants depend on the half-life of the drug or medication. Alcohol withdrawal symptoms can develop as early as 4 to 6 hours after alcohol cessation, or a reduction in heavy and prolonged abuse. Interventions for alcohol withdrawal include assessment of the client for symptoms every 4 hours, so that necessary interventions can be implemented. Here again, safety is a priority and the client must be protected from injury. Encourage decaffeinated beverages and monitor the client's diet, and it's best to keep the client in a minimally stimulating environment. Benzodiazepines can be used to manage withdrawal symptoms from alcohol. The medications are prescribed and then slowly tapered until the client has been safely detoxed. Vitamins, folic acid, and thiamine are given to clients who abuse alcohol because alcohol impairs the absorption of B-complex vitamins and the client's nutritional status is impaired. The serious effects of alcohol consumption include peripheral neuropathy with pain and decreased sensation in the legs, Wernicke's encephalopathy, a degenerative condition resulting in vision, memory, and coordination changes due to thiamine deficiency, Korsakoff's psychosis, a degeneration in the thalamus due to vitamin B12 thiamine deficiency, which results in short-term memory loss, an inability to learn new skills, and peripheral neuropathy. Esophagitis, pancreatitis, gastritis, hepatitis, and ascites. Liver cirrhosis. Nutritional deficiencies with decreased vitamin A, D, and K, decreased B vitamins, and anemia due to decreased RBCs and WBCs. Once a substance abuse disorder is identified, nursing care includes a structured treatment environment. Group therapy can provide insight into the consequences of substance use on their physical health and for their family and friends. Stress management and positive and negative reinforcement for behavioral modification can be used. Regression or relapse is a common concern because often the underlying problem is not resolved. Support groups are available for clients to share their experiences and offer support without giving advice or passing judgment to group members during times of crisis or relapse. In addition, disulfiram, antabuse, is used to discourage impulsive alcohol use. Clients cannot consume any substances containing alcohol when they take antabuse. These substances include over-the-counter medications such as cough syrups and cooking wines, plus any food or beverage items prepared with alcohol. Antabuse causes vomiting and hypotension when followed by the ingestion of alcohol, and alcohol products should be avoided for 14 days after antabuse is stopped. Informed consent is essential prior to beginning treatment with antabuse. Central nervous system stimulants can lead to psychological dependence. Intoxication can cause violent, aggressive behavior or even psychotic episodes. CNS stimulants include amphetamines, cocaine, caffeine, and nicotine. Effects on the body include CNS stimulation, pupil dilation, increased body temperature. Cardiovascular, pulmonary effects, heart rate and respirations are increased. GI and renal effects, hunger and increased urination. Mental health, agitation, grandiosity, talkativeness, elation, impaired judgment. Withdrawal from stimulants can cause fatigue, sleep disturbances, increased appetite, anxiety, difficulty concentrating, and restlessness. Now let's discuss opioids. Opioids include morphine, heroin, codeine, and synthetic opioids. You remember that Narcan is given to treat an opioid overdose, and methadone therapy may be used for withdrawal. With opioids, tolerance and physical dependence can develop rapidly, and withdrawal symptoms can appear within 6 to 24 hours and then diminish over several weeks. Effects on the body include CNS depression, dilated pupils, drowsiness, impaired memory, gastrointestinal, digestion and peristalsis, cardiovascular, heart rate and respirations are decreased, impaired judgment, sexual dysfunction. Medical complications include HIV, hepatitis, ulcer disease, anemia and nutritional disorders, and other serious side effects. And withdrawal symptoms include sweating, vomiting, diarrhea, weakness, tremors, runny nose, fever, irritability, and depression. Next, we'll cover hallucinogens. Hallucinogens include LSD, PCP, mescaline, and other designer drugs. They cause perceptual alterations, depersonalization, and derealization. These symptoms can develop within several hours of taking the drug. Additionally, a client who has taken PCP can have symptoms of agitation and combativeness. Hallucinogens' effects on the body include cardiovascular system, tachycardia and palpitations with elevated blood pressure, mental status, hallucinations, delusions, paranoia, ideas of reference, anxiety, grandiosity, central nervous system, dilated pupils, tremors, a lack of coordination, euphoria, sweating, fever, nausea and diarrhea, and irregular respirations. A client is admitted to the substance abuse unit from the emergency department. He was aimlessly walking in the streets and told the nursing staff that he was being chased by criminals and the police. He admitted going to a PCP party. As a nurse, what interventions would you plan for the client? You would monitor vital signs, protect the client from harm to self or others, decrease stimuli, use a calm approach, and implement close observation if necessary. Pot, weed, cannabis, marijuana, no matter what you call it, it's a commonly abused drug. Symptoms of marijuana use include impaired motor coordination, euphoria, anxiety, a sensation of slowed time, and impaired judgment. Impaired motor skills can last for 8 to 12 hours, and withdrawal symptoms include headache, fatigue, and restlessness. Marijuana's effects on the body include cardiovascular, tachycardia, bloodshot eyes, and increased appetite. In the central nervous system,